everyone, I'm Anastasia. Welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed about the input and output record, there we've got an idea of why is this important, what is the purpose, what are the physiological basis, as well as for whom is this indicated, right? In this session, we are going to discuss about the intake and output procedure. So here, as we know that intake is defined as the measurement of the patient fluid intake either through mouth, through the intravenous fluid, or even through the tube feedings, right? Whereas output is defined as the excretion of the patient either from the kidney, from the gastrointestinal tract, from the drainage tube, or even from the wounds for 24 hours, right? So why do we maintain this? We maintain this record. We record the input and output of a patient in the chart in order to get a detailed idea of the amount of fluid which the patient has consumed as well as excreted, right? Because here, as we know that the intake and output must be equal. So here, by measuring the intake and output, by recording it, we will get an idea also about the progression of the disease as well as the beneficial of the treatment which has been provided for the patient. So now we are going to discuss about the intake and output procedure. So as always, before we perform any procedure, we must arrange all the equipments which will be required, right? So here, before you even perform this intake and output procedure, you must make sure that you arrange the collection device, which can be the bedpan, the urinals, the pedi-u bag, the urinary drainage bag, the speci hat, or even the diaper or diaper scale. What is this collection specimen? It is a place where you will be collecting the urine so that you will be able to measure it, right? So here, depending on the condition of the patient, there are various collecting devices which you can provide. You can, either provide the bedpan, the urinals, the pedi-u bag, the urinary drainage bag, the speci hat, or even a diaper and a diaper scale. There must also be a graduated measuring cup so that you will be able to measure the urine which will be collected in this device. And then there must also be an appropriate documentation form for the parents so that they will be able to note down the intake and output, as well as a computer or flow sheet for units who are using the paper flow sheets. So as I've said, that it is very important that we must monitor the intake and output of a patient, and here it is also very important that you must record this. So where will you record it? You will only be able to record it in the intake and output chart, right? So as a nurse, when you measure, you can directly record it in the intake and output chart, whereas sometimes when you need the help of the parents to, sometimes record it, because here, yes, as nurses, we will be the one who will be providing care. We are the ones who will be administering the medications, the intravenous fluid, or even the tube feedings, right? But also when it comes to those clients who are able to consume fluid orally, then we cannot always be present. We cannot always get a detailed idea of how much fluid he is consuming, what is he drinking at what time, because here, as we know that we are responsible for taking care of many number of patients. So here, for those patients who are able to consume orally, then here we must also provide a documentation form for the parents so that they will be able to document whatever fluids they had provided for the patient in the absence of the nurse. And for those units who are using paper flow sheet, then here a computer or flow sheet must also be arranged. So these are the equipments which you must arrange for the intake and output procedure, because here in intake you will already be providing the food or the fluids, right? And here this will already be measured before it is provided himself. So here, in order for you to get an idea of the intake and output, the amount which will be provided will already be documented, but the amount of output must be measured, right? So for this, we will be needing this collection device, will be needing a measuring cup, as well as we will be needing a flow sheet or even a documentation form. So these are the equipments which will be required for the intake and output procedure. And you might be thinking, why just these? Because here, intake, when we talk about intake, we will be providing the fluids or the food or the medication, right? Even if it is through orally or intravenously, we will get a detailed idea of how much it is, and this can automatically be documented. But when we talk about the output, here why we need to measure, because we do not know how much output. This is the reason why when we talk about the equipments, you will see that we only need the collection pan, the measuring cup, as well as the documentation form or even the flow sheet. So after all these equipments has been collected, then only you can start with the procedure. And here again, before you start with the steps, you must make sure that you first teach the patient and family method of recording the intake and output, because here, as I've said, especially if it is for those patients who are able to consume fluid orally, then here we may not always be present, we may not always get a detailed idea of how many times he or she has consumed and what is the amount that he has consumed. So here it is very important that we must educate, we must teach the patient and the family members about the method of recording the intake and output. And for this, we need to provide a paper and pencil so that they will be able to record it, as well as a parent documentation form must be kept at the bedside. Once this has been done, then only you can start with the procedure. Now, let us first discuss about the intake procedure. Here again, before you perform any procedure, as I've repeatedly been saying that, before you start any procedure, you must wash your hands. Again, here, before you start this intake procedure, you must make sure that you wash your hands in order to prevent the cross-contamination or the cross-infection. And then you must identify the right patient, because here right treatment must be given to the right patient, right? So here, in order to be clear, in order to make sure that whatever you are doing is for that patient which was prescribed by the physician. So here it is very important that you identify the right patient. And then before you provide any fluid to the patient, you should make sure that it must be measured in milliliters. So how can we do this? We can do this by being aware of the quantity amount of different containers, right? So here, as I've said, that we must always record the intake of a person, right? So here again, before you provide any fluid, you must make sure that you measure it in milliliters. And here, for those which you can, provide the whole container or the whole bag, then it will be easy, because the quantity amount will already be specified in the container, right? So directly, without measuring, you can also note down the amount which you will be providing. However, in cases where you should not provide the whole amount which is present in the container or in the bag, then you must make sure that you first measure it. After it has been measured, you must record it, and then only you can provide this fluid. And you must also check with patient to make sure that all the fluid that the patient is consuming has already been measured, and it must also include those fluid that has been served during meals. Because here, as I've repeatedly been saying, that if it is for those clients who are able to consume food, to consume fluid orally, then here the amount of fluid which they will be consuming, we might not get a detailed idea of it, right? So that is why you must make sure that you educate the patient that whichever fluid he or she will be consuming, she must first make sure that it has been measured and noted. However, if the patient is under any parenteral intake or tube feeding, then this intake will be closely monitored and documented hourly by the nurse who is providing care for this patient. So here, recording the intake of a person who are under the parenteral or the tube feeding is more easy than recording the intake of a person who can also, consume it orally, because here, those people who can consume it orally, then we may not get a detailed idea of what are they consuming, at what time and at what amount. But if it is for these patients who are only under the parenteral intake or the tube feeding, then here measuring the amount of intake is comparatively easy. So here, this intake will be recorded on the appropriate form or even in the computer, depending on the policy which the hospital is following. And as I've also said in the definition, that this measurement of the intake and output will be continued for a 24-hour period, right? So here this intake will be total for the entire 24 period, that is from 7 a.m. to 7 p.m. Whereas for those units who are using the paper flow sheet, then here the intake will be total at the end of each shift. And also here, if the patient is under the parenteral intake or IV fluid, then here we must also rate and document the IV fluid administration. So here these are the various steps that you must follow in order to measure as well as to document the intake of a person. Now let us discuss about the output procedure. So here, since I've said that output is the measurement of the patient's output either from the kidney, from the gastrointestinal tract, from the drainage tube, or even from the wound, right? So here, before you measure the output of a person, then you must first wear your non-sterile gloves, and then you can start pouring the urine into the graduated measuring cup, so that you will be able to measure, and then you can discard off the specimen. However, if the specimen is required for any lab studies, that is for a 24-hour specimen, then only this specimen will be stored. So while doing this, in order to get an accurate measurement, what we can do is, for those ambulatory patients, we can provide them the speci hat, whereas for those non-toilet trained patients, we can provide urinary bag, we can catheterize them, as well as we can provide diapers. However, when you provide these diapers, you must make sure that you first weight them, and then only you can, provide these diapers to them, so that at the end, we can subtract the weight of the diaper before it has been used from the total. And if the patient is on strict input and output, then here, if their fecal matter is predominantly liquid, then we can pour it into the graduated measuring cup to measure it. However, if we are not able to measure it, then we must estimate the amount, or even know the number of times the patient had passed stools in 24 hours. And if it is more than one bowel movement per hour, then we must make sure that we document the frequency as well as the number of times per hour. And if the patient is vomiting or if the patient is bleeding, then this must also be measured. And if not, we can estimate it, because here, if a patient is bleeding, then it might be impossible for us to measure the blood, right? But here, if the patient is vomiting, and also if he is vomiting more than once per hour, then the frequency as well as the total number that the patient vomits per hour must be documented. And as an input, even here, the output will be totaled every 24 hours, that is from 7 a.m. to 7 p.m. Whereas if it is in those units who are using the flow sheet, then this will be totaled at the end of each shift. So here, if we are providing the bedpan or the urinary bag, then it can easily be measured, right? That is, we can just pour it into the, graduated measuring cup and we can measure it. However, if a diaper has been provided, then as I've said, you must first weight the diaper in the gram scale before it is given to the patient, and at the end, after it has been used, you must again weight it in the same gram scale, and you must subtract the weight of the diaper before it was given to the patient from the total. For those patients transferred from PICU, ER, as well as the recovery room with strict output order, we must have their output recorded from the time they was being admitted to the time they are transferred. And this can be done by measuring it and recording it in the input and output chart or even in the computer. And for those patients transferred from the PICU, the ER, or even the recovery room with strict output order, then here we must make sure that we always measure as well as record their intake and output in the intake output chart or even in the computer, as well as this must be done from the time they was admitted till the time they are transferred. So these are the various steps that you need to follow whenever you are measuring measuring and recording the output of a patient. So now here we have come to the end of this topic, whereby in today's session we have discussed in detail about the various steps that we must follow whenever we are measuring and recording the intake and the output of a person. So I hope you have got a clear understanding of what intake and output is, what are the importance, what are the purpose, what are the physiological basis, for whom is it indicated, as well as the various steps that you need to follow whenever you are measuring and recording the intake and output of a person. So I'll be meeting you in another session. Until then, have a good day. Thank you.